In the Bureau of Water, we work to protect and preserve state water resources for drinking, swimming, fishing, and other uses to benefit present and future South Carolinians. DHEC administers and enforces drinking water quality standards and regulations by working with public water systems to keep our drinking water safe. We're excited about a new grant program that will give us an opportunity to work with schools and child care facilities to sample for lead and improve water quality for our children. It is an Environmental Protection Agency funded program to assist with testing for lead in drinking water at schools and child care facilities across South Carolina. Many schools and child care facilities are served drinking water by a public water system, and while these systems have done the required regulatory sampling, many school and child care facilities have not had their faucets sampled specifically. This grant will be used to do just that: analyze the water in schools and child care facilities. The principal objective of this program is to assist schools and child care facilities in testing for lead in their drinking water, utilizing the EPA's 3 T's for reducing lead in drinking water in schools and child care facilities guidance. The goals of the grant program are to 1. Reduce children's exposure to lead in drinking water, 2. Fund the cost of sampling and testing the water at identified schools and child care programs, and 3. Utilize the 3 T's model to establish best practices for a lead in drinking water prevention program while enhancing community, parent, and teacher cooperation and trust. Our #1 ranking criteria for participation in this voluntary grant program is age. Age because we know that youth are the most impacted by exposure to lead. We're working with our partners and some criteria to identify the most vulnerable populations. We will keep sampling until we spend every grant dollar on valuable data. Other ranking criteria other than age include sites located in a state opportunity zone, construction dates prior to 1988, population size or the number of youth served at the school or child care facility, and finally, geographic blood lead level data. EPA's 3 T's, training, testing, and taking action, provides tools for schools, child care facilities, states, and water systems to implement voluntary lead and drinking water testing programs. DHEC is using EPA's 3 T's guidance as a model to train on the risks of lead in drinking water and testing for lead, test using appropriate testing protocols and a certified laboratory, take action, including the development of a plan for responding to results of testing conducted and addressing potential findings where necessary. Sampling will be conducted using established sampling protocols. The DHEC lab and EPA certified lab will provide the sampling results. Most importantly, all fees associated with sampling will be covered by the grant. Partners in the implementation of this grant program include the South Carolina Department of Education, the South Carolina Department of Social Services, Clemson University, South Carolina Rural Water Association, regional and municipal water utilities, local health departments, and especially school and child care facility staff and personnel. Children 6 years old and younger are the most susceptible to the effects of lead. Their growing bodies absorb more lead than adults, and their brains and nervous systems are more sensitive to the damaging effects of lead. Even at very low levels of exposure to lead, children may experience effects including lower IQ levels, reduced attention span, hyperactivity, poor classroom performance, or other harmful physical and behavioral effects. can enter drinking water from a building's plumbing system. It may be present in various parts of the plumbing system, including lead solder, brass fixture, water fountains, and lead or galvanized pipes. When water is left in pipes and in contact with lead plumbing materials, lead may leach or seep into the water. The amount of lead in drinking water depends on how corrosive the water is, the materials used to construct the plumbing fixtures, and how long the water has been in contact with lead in the pipes or fixtures. The longer water stands in the plumbing system, the more lead the water can absorb from lead-based plumbing fixtures and components. Remediation is solutions that can be implemented when issues are suspected or discovered. Many solutions can be implemented at no or low cost. They include things such as flushing taps prior to use, opening taps and letting water run for 2 to 10 minutes to remove water that has been standing in interior pipes or outlets. Other remediation efforts include changing filters at problem taps, changing faucet apparatuses, shutting off problem outlets or water fountains, utilizing bottled water, or establishing routine practices such as flushing Mondays or regular cleaning protocols, temperature control, or point of use filter maintenance. Additional resources and information about the lead testing in school and child care program drinking water grant can be found on the DHEC website at the link on your screen. There you will find links to the EPA's 3 T's manual, DHEC resources about lead in drinking water, as well as informational fact sheets, frequently asked questions, and program manager contact information. Thank you for taking the time to watch this video. We in the Bureau of Water remain committed to promoting the DHEC vision of healthy people living in healthy communities.